more in the entire public health workforce, including nursing and midwifery, to build strong and resilient health systems.
像此刻如此清晰，如此凸显了各个国家有这个方面投资的重要性。各国需要投资于整个的公共卫生的卫生队伍，包括护理人员，以便进一步的建制强有力的并且有弹性的卫生系统。
This is a critical lesson from COVID-19 and one that we cannot afford to miss.
这是新冠肺炎教给世界的重要一课，我们不能忘记。
Thank you.
谢谢。
好，谢谢。
Thank you, Dr. Golden Gowley, for your initiatives on behalf of WHO. As DJ Tandros of WHO was mentioned that for health workers, you are at the special difficulties of the pandemic of COVID-19. Such a job is very holy. We would like to show our respect to you, and we believe that you will try your best to control this pandemic. This pandemic will be over one day. However, the respect for health and respect for doctors shall be the common sense of people, and let's uphold the theory of people's life and try to realize the dream of a better health and a better life for Chinese people and for people around the world. Now we start the question and answer. Please identify yourself before you ask questions. Now the floor is open. On the right side, the first row, the lady journalist. Thank you, Mr. Li. I'm from Xinmin Evening Post. And in medical workers, nurses are very important part of the team. And the nurses are playing an important role in fighting against COVID-19. So how Chinese government show their care and support to nursing profession and the nursing team. Now the floor is given to Madam Guo Yehong. Thank you for your question. As people said, nursing is an important component of the health system in promoting and maintaining people's health. Nursing plays an irreplaceable role, and the nurses, and they are trying to save lives and trying to alleviate pains and trying to promote people's health. Just now, I appreciate Dr. Golden Gowley in his saying that our nurses are working at the forefront of this COVID-19, and they are fighting for safeguarding people's health and people's life. So in maintaining and promoting people's health, in saving lives, nurses plays a key role, and also in the birth to the whole life, to the death of people, nurses plays an important role. Nurses are trying to promote and maintain people's health. On the other hand, they are trying to alleviate the pain of the patients. So the jobs of nurses are vital to the health of every human being. The party and the government pay high attention to the development of a nursing profession and the building of a nursing team. In 2008, nursing regulation was promulgated to safeguard the rights and interests of nurses and to build a better team of nurses. In 2005, and we have issued since then, we have issued a 3 5-year plan. Through the implementation of this 3 5-year plan, we have built a better team of nurses and enhanced the capability of nurses, and we have promoted the nursing jobs to be in line with the needs of the society, in line with the needs of the clinics, and in line with the needs of the patients. It should be said that in the past years, nursing profession have progressed greatly in China. The nursing team are growing. In 2009, the total number of nurses in China reached the 4.45 million as compared to 2018. In 1 year, it increased by 350,000. So in 2019, the figure is 4.45 million. 1 year increase is 350,000. It means that nursing team enjoyed a very fast growth. While the number is increasing, we also strengthen the training for nurses. On the second part, we are trying to strengthen the capability and professional expertise of those nurses. As you may say that in this COVID-19 fight process, especially for severe cases treatment, this strong team of professional nurses played an important role. For severe cases, as you may know, ICU, everybody is familiar with ICU now. ICU means intensive care unit. Intensive care unit. So it means that intensive care for the severe cases. Well, in the treatment of severe cases, nurses will follow closely the changes of the patients. And for invasive treatment of the patients, the nurses are very careful, and they are working together with the doctors to increase the cure rate and to reduce the fatality rate. On the third front, the content and the external impact of nurses are increasing because China is rapidly aging, and we are facing domestic nurses and also nursing before death, and also maternity caring and nursing. All of this require the key role of nurses in China. Besides this, international communication on nursing are also increasing in China. We are working together with WHO and other countries and organizations in training nurses, in developing their professional skills, and in communicating on the standards and procedures. Through this kind of communication, we can make progress together, and we also can share the nursing experiences from different countries. So with the support of the party and the government, with the concerted efforts from the society, nursing profession are developing flourishingly in China, bringing contributions to people's health. In the future, we will further promote the nursing profession in China in several fronts. First, we will strengthen nursing team development and implement this nursing regulation and protect the rights and interests of nurses, create a better working environment for them, protect their rights and interests, enable their workplace safety, pay more attention and care to nurses working on the front line, and protect them, care about them. In this way, when they work, they will don't have any doubts and the whole life of their career. They need school training, and also they need on-job training as well. So through training, we can increase the professional qualification of nurses. In this way, we can increase the capability of such a nursing team. The third effort we are making is to bring nurse job to be more professional, and also, on the other hand, when people need, we will have nurses to work for them. So the content and external impact of nurses will be increased. Fourthly, I want to emphasize here, we will strengthen our communication about nursing's job and importance. Nursing's job is ordinary, but also holy, and because nurses can save lives. So we should work together to communicate about the importance of nurses, and also to communicate the stories about their respect to life, enable the society to understand, love, and support such a team of nurses. Well, in the building of the nursing team, the Chinese Nursing Association plays a key role. So here, I would like to give the floor to the chairman from the Chinese Nursing Association, Madam Wu Xinjuan, to say a few words. Chinese Nursing Association is an association with a long history, and we have been established for 115 years. So for this Chinese Nursing Association, in recent years, our association are working hard in offering professional guidance in unifying our nurses and members and setting up standards and communicating knowledge to the public. And we also play a role in innovation, in team building, and in training for nurses. The association has played many roles in the above-mentioned fronts. Just now, Madam Guo have mentioned that around the country we have 4.45 million of nurses. And all the nurses have made a contribution to the health of Chinese people. On the other hand, our association is also a member of International Nursing Committee. And we are working together with our international peers on communication and cooperation. In this process, in the fight against COVID-19, Chinese nursing experiences have been communicated to international peers. When the acclaim from international peers, our experiences are very helpful for them. Thank you.
继续提问。
Thank you. Next question, please. Journalist from the first row on the left hand. Thank you. With the Hong Kong-China review, there are now over 1 million COVID-19 confirmed cases globally. As WHO puts it, COVID-19 has become the first coronavirus-caused pandemic. Will the control measures such as washing hands, social distancing, currently taken by many countries be enough to get rid of the virus? I'd like to ask Dr. Gordon Gualia to take the question.
Indeed, it is. It is impressive what a great toll on human suffering, on the numbers of deaths, and on the economies of the world the coronavirus has taken.
是的，看到这样的致死率和这些触目的数字，能够想到的就是新冠肺炎对人类的经济和社会的发展造成了多么大的影响。
The numbers continue to grow and are clearly far from having reached the peak.
依然在增长，而且很明显尚未到达顶峰。
The only way that we will overcome it is when we have achieved the status that everyone has been vaccinated by some future vaccine, that is, has achieved immunity either from having been exposed to the virus or taken a vaccine that provides immunity.
什么时候我们才能说真正已经战胜了这一场疾病呢？这一场疫情是要等到有经过经验证明有效的疫苗，人群能够得到疫苗接种的时候，或者说在人们在暴露于病毒之后，已经形成了足够广泛的人群免疫时，才能说我们真正的战胜了疫情。
Until such a time, we are given what we might call the old-fashioned public health methods that have stood the test of time.
在此之前，我们说传统的、老式的这种方法已经得到了经验和时间的证明。
We need to assess the risk at levels that range at the top from country level down to the individual.
我们需要对风险进行评估，上至国家层面，下至个体层面的风险评估。
This can be achieved by testing, testing, as has been said by the Director General of WHO.
要实现这种风险评估，那就需要做检测、检测、检测。这也是世界卫生组织的总干事之前所强调的。
It is important to understand in each community how much transmission is taking place. Is there actually the virus? Here in China, most communities are now free of the virus, and it is only the cases that we are hearing are basically imported cases. So is there evidence of transmission? Is it just sporadic cases? Are there clusters of cases, or do we have community transmission?
要实现这一点，除了做这个评估之后呢，各个社区也要能够了解，在社区层面、在群体层面上，到底有多少传播依然在发生。在中国呢，我们刚才已经听到了疫情通报的最新的数据，在社区和群体的层面上已经鲜有这种传播。现在主要是输入病例方面的影响，所以除了刚才所强调的检测之外，另一点就是要清楚地了解有多少传播，包括偶发病例、聚集病例等。
And then the measures that are available to us range from the universal precautions, such as hand washing, respiratory etiquette. Many countries have adopted the use of masks, which is still under review by expert committee, but they are being used in a number of countries as they have.
聚集到一起，以便更快地寻找到有效的疫苗或药物。
Thank you.
谢谢。
谢谢。
好，谢谢，请继续提问。好，我们请左侧区第2排第2位女记者。
谢谢主持人。健康报记者提问：李克强总理曾提出明确要求，要加强对出院复阳患者的管理。那么，我想请问，对于治愈患者的复诊复查有哪些具体的措施？该如何帮助他们更好的康复？谢谢。
好，我们请王贵强医生来回答这个问题。
好的，谢谢这个记者的。等等一系列问题都需要进行研究。
And in the guidance, we specified post-hospital discharge management. So in the course of treatment, the hospital will provide the information of this patient to the observing hospital while this patient is discharged. And this patient, after discharge, should stay at home to observe his or her own health, and also he need to wear a mask and also stay in isolation, avoid contact with family members, so as to ensure that after discharging, this patient will not result in further transmissions risk. And also we will monitor the health situation of this patient closely, because their immune system may decrease. So we have to observe them carefully. So we emphasize full course management of this patient. While for NHC also issued a set of documents saying that after discharge, recovery management, stay-at-home management should also be paid attention to. In the document of HC, it is mentioned that they should take a temperature every day, and after discharging from the hospital, within 2 or 4 weeks, they have to visit the hospital for checks, and we have to look at some lab symptoms and check their blood, and also look at their antibody. And we will also observe their lung CT scan image of their lungs, because COVID-19 patients, for many of the patients, and we say the pulmonary fibrosis, whether their lung can recover, whether this fibrosis can come back, can recover, we have to observe after discharge. We will adopt intervention measures if we found any symptoms. So we are very careful about the monitoring of discharged patients, so as to avoid the coming back of the disease. People are talking about relapse or reinfection, and for these patients, we have to manage them carefully to avoid the transmission risk. All in all, for those discharged patients, they are under close monitoring and surveillance of us. We hope that all the hospitals within China can manage those hospital discharged patients carefully. Thank you. We have further questions. Now the floor is given to, on the right side, the 5th row, the gentleman. Thank you. I'm from Phoenix TV. We found some data showing that the fatality rate of other countries exceeded Wuhan, and the fatality rates are increasing. So I want to know whether WHO have any suggestions to reduce this fatality rate. Now the floor is given to Dr. Golden Gali.
It is we have observed globally, but starting with China, a very wide range of case fatality ratios.
我们有对全球观察的数据，同时呢，也有观察中国的病死率方面的数据。
If you remember, in China, the case fatality ratio was extremely high in the first series, in the first small number of cases.
最初在疫情爆发的最初，曾经有一小部分病情在最初出现的时候，它的病死率是较高的。
And this is common in an emerging infection and was very much played out here in China with the over time to the observed numbers of the order of 4% or above them in Wuhan, but below 1% in other provinces.
这在出现一种新发传染性疾病的时候是非常常见的现象，也就是在新发传染性疾病刚出现的时候，病死率是较高的。然而后续呢将会出现一段时间的下降，直到我们在后面看到，在武汉的病死率大概是4%左右或再高一点，其他的地方，在中国其他地方的病死率是已经下降到了1%以下。
Clearly, the surge in the number of cases is part of the question, part of the explanation. As the number of cases exceeds the ability of the health service to provide intensive care, then there is a higher risk of patients succumbing to the disease.
很明显的一个解释的原因呢，就是当病例数在激增的过程中，卫生系统已经不堪其负，尤其像重病监护这个方面的卫生系统已经没有办法去承担如此之多的病例，那就解释了在一种新发传染性病发生之初，为什么会有较高的病死率。
We have seen that provinces in China that succeeded in spreading the epidemic, keeping it at low numbers over time, so-called flattening the curve, have succeeded in keeping the load down and reducing mortality.
但我们看到了中国的各个省份成功的使得病死率出现了进一步的下降，并且呢，在最初急剧攀升的这种曲线，在后续被做得更加的平缓了，取得了极大的成功，降低了病死率，并且也降低了医务卫生系统所经历的这些负担。
There is probably also a learning effect as a cohort of health professionals become more accustomed to treating cases. They become also more skilled in saving lives.
此外，也很自然的有一种学习的过程。当医务工作者和护士对这种疾病越来越熟悉的时候，他们也能够提供更高质量的救治。
It is also possibly, as one looks around the globe, there may be different policies as to how people are counted as cases, and it may be that the numbers are higher because not enough mild cases have been tested and identified.
也可能看到全球在做病例的技术方面会有不同的一些政策，比如有一些病例最初高发的这种情况，病死率高发的情况是由于轻症当时并没有被作为病例作为分母计算进来。
And indeed, China has a policy of extensive testing, and therefore you end up with a much greater denominator, and that is also, you find more mild cases, and they therefore create a base for calculating that rate that is higher. That larger number of cases may also result in a relatively smaller number of deaths.
因为中国的政策是非常重视检测的，后续呢我们也做了更多的广泛的检测，那这样呢就使得分母，也就是总的病例数更加的准确，分母也得到了扩大，相应的病死率也会有下降。
Indeed, even in Wuhan, there have been studies that have modeled the real case fatality ratio, and they have established it at around 1.5%, 1.4%, which is even smaller than the amount that we have quoted, simply by looking at the numbers of cases and the numbers of deaths.
武汉也有在做 病死率、致病率方面的一些建模性的研究，那后续达到的是1.4%、1.5%这样的一个计算的结果，这要比我们单纯的只是看最初计算的病例数和死亡病例数做的这个比较呢，致死率依然要更低一些。
So there's a wide range of hypotheses and explanations. I can add more, but the biggest message for us here is the importance of having well-prepared health systems with a capacity that is kept higher than the surge in the number of cases.
在致死率方面有众多的假设、理论和不同的解释，但是从致死率的分析对比中，我们得出的重要的有指导实践意义的结论是要让卫生系统做好更好的准备，使其有能力能够去应对在特殊情况下激增的卫生需求。
Thank you.
谢谢。
好，谢谢。
Thank you. Now we allow further questions. People on the left, on the third row, the third gentleman. Thank you, Chair. I'm from CGTV, TN. The joint medical team have been working in Hubei for 70 days. We have learned many impressive stories, and we have many nurses who are born in 1980s and born in 1990s. And how many of them are female, and what roles they have played in the cure of COVID-19. Now the floor is given to Madam Guo. Today, this year is a special year because of COVID-19. COVID-19 is the most severe and the fastest spreading, the widest spreading public health event since the birth of New China. And after COVID-19 happened, according to the party and according to the central government, medical teams from different provinces were sent to Hubei. In total, 400 and in total, about 420.5 thousand medical workers go to Wuhan. Among them, 70% are nurses. Looking at the age competition, people born in 1980s and born in 1990s take up 90% of all the nurses. And for nurses born after 1990s, take up 40%. So these young nurses are working very hard, braving the risk, and they forget their own life and try to save the life of others. They show how the youth can be used in a good way, and they are examples for other youngsters. For among nurses, female nurses take about 90% of the total nurses to Hubei province. So the young female nurses are playing a key role in this COVID-19 prevention work. And in terms of prevention, severe case, respiratory discipline, infectious disease, and also CRRT discipline nurses are working hardly on the front line. All these nurses are working very hard in this mobile hospital for the cure of mild cases, and they have to observe the cases carefully, especially in observing those mild cases. They have to prevent those cases migrate to severe case. So they have to follow the cases closely. And also, the patient are in isolation, in quarantine, and the patients suffer from fears and panic and anxiety. So the nurses are providing them with psychological support, helping them to alleviate the pressure and helping them to receive the treatment happily. So the nursing of patients is both physically and psychologically. For severe cases, it's even more so, because for severe patients, and the nurses have to provide a lot of nursing tasks because these patients cannot support themselves. They are on ventilators, on different pipes, so it's difficult to serve these patients. And also, we have to help these patients to get more breathing so as to increase their oxygen within the blood. This increased the difficulty of nursing and increasing the burden of nurses. For severe case nursing, it is very difficult. Those patients are longing for psychological support and communication as well to enable them to feel love and respect. So in the fight against the disease, we should not only have medical skills, but also provide the patients with the confidence to overcome the difficulties and overcome the disease. So nurses in COVID-19 work are playing an important role in increasing the cure rate and decrease the fatality rate. They have made professional services to the patients. Thank you. We allow further questions. On the left side, fourth row, the lady journalist. Thank you. From CGTN Financial Channel, we know that in the fight against COVID-19, nurses have accumulated many nursing experiences. What are the best nursing experiences, and how can we share these nursing experiences with other international peers? Thank you. Now the floor is given to Mr. Wu Xinjuan. On February 7th to 25th, Madam Wu Xinjuan joined the Peking Union Medical College Hospital and to offer medical help to Wuhan. So the floor is given to Madam Wu Xinjuan. Chinese nurses are playing their unique role and showing their strong professional skills and showing their strong psychological resilience in this process. And all these nurses have won high acclaim from the party, from the government, from people from China and abroad. In this process, Chinese nurses have accumulated some nursing experiences, and we are working actively to share these experiences with our international peers. For example, for severe cases, we are trying to strengthen the overall surveillance of them, and nurses try to combine medical treatment with nursing together so as to increase the cure rate and decrease the fatality rate. For severe cases treatment in Hubei, we summarize our experiences. HC of China issued COVID-19 severe and mild cases patient nursing guideline and standards. And these standards specified how can we set up ICU for severe cases, human resources management for ICU, and also for case monitoring and nursing standards so as to achieve the close linkage between medical treatment and nursing services. We also pay attention to the underlying conditions of the patients, provide professional services to them, and provide psychological counseling to them. In this way, we can increase the effectiveness of the treatment. For COVID-19, because this is a new infectious disease, newly emerging infectious disease, from the very beginning, our understanding about the disease are limited, but after several weeks, we come up with a standardized practice of nursing. We summarize our nursing experiences as well. This is very important for communication.
Peking Union Medical College Hospital's medical team provided intensive care for the patients, and we have been summarizing our practices and experiences. For example, for the severe patients, we worked out standard SOPs for their transfer into and transferring out of the ICUs. And these standards have played an important role in ensuring the safety of the patients and the better treatment. The residents management standards have also been worked out and improved to safeguard the health and safety of medical team members. We've also compiled a nursing handbook. We've also worked out the standards for treating the severe cases and the critical cases. Experts' consensus have been decided. We collaborated with the national medical team experts. All these down-to-earth guidelines, handbooks, and practices and standards have won acclaim from colleagues across the country. And these sets of standards, handbooks, have also played an important role in improving the nursing practices. This has also become important knowledge contribution to the global nursing practices. Shortly, International Nursing Council, or ICN, convened an online discussion for COVID-19 nursing. 70+ nursing associations from across the globe participated in that online conference. I was honored to be invited to that conference, and I delivered a speech on our experiences in nursing care provided to COVID-19 patients, in particular the severe and the critical patients, the professional training, and also the training to ensure zero infection among nurses. These clinical experiences have provided important lessons and experiences for the world to refer to. Next question, please. Journalist from the third row on the right side. With CCTV. My question goes to Dr. Garden-Galia.
Just now, when we talk about the fatality rate, and Mr. Garden-Galia have talked about the capacity of a health system, because now many patients are coming to the hospitals around the world, so the capacities of these hospitals are exceeded. How can we solve this overcapacity situation of those hospitals? And also at the outbreak of disease in Wuhan, and we face similar problems. Can China's experience be of reference to other countries? Now the floor is given to Mr. Garden-Galia.
This is a major issue, and it's a very good question that is facing every country around the world now.
很好的一个问题，这是每一个国家目前都面临的重要问题。
For those countries that are at the stage of still before the epidemic has taken off, there is time to prepare, and in the urgent phase, this early phase of low growth before the exponential growth takes off, then countries should be preparing at the highest level that they can in order to be able to have enough ventilators, enough staff, enough preparation and understanding in order to be able to take the number of cases that will be coming.
对于那些尚处在疫情早期的这些国家，当我讲到早期，是指目前的病例数增长依然较为缓慢，尚未达到指数性爆发性增长的这些早期的国家，他们应该借此时机做全力以赴的准备，包括准备足够数目的呼吸机、医务人员、人手，做相关的知识方面的准备。
Solidarity between countries is very important, and cooperation is going to be needed in order to support those countries with less resourced health systems, to be able to provide them with the equipment, the personal protective equipment, the testing, and other supplies that they will need in order to handle their challenge, their epidemic.
各国的团结与合作在此刻也显得非常重要，以便进一步的去支持那些卫生系统和卫生资源较为少的国家，需要为他们去提供相应的医务工作者的个人防护设备，提供检测试剂及其他的一些医疗物资，以便使其卫生系统有较为充分的医疗资源。
Within larger countries or within natural groupings of countries, the example of China is quite compelling in the way that different provinces were twinned up with different cities in Hubei, for example, and provided the healthcare services, both equipment as well as healthcare workers that were needed in that spirit of solidarity.
大的一些国家，还有不同的自然形成的国家集团彼此之间所展现的这个时期的合作和团结也尤为重要。可以学习中国如此有说服力的成功的例子，比如以省援鄂、以院援鄂这种做法，包括为湖北、为武汉提供医疗资源，提供必要的防护设备，还有像医疗队。驰援武汉去提供这样的支援。
And some countries will not be able to afford the high technology and the large numbers of trained healthcare workers that are needed. And in such countries, the more rigorous application of the public health measures that I spoke about earlier will become crucial.
而有一些国家，他们负担不起这样高科技的相关的医疗物资，或者他们没有高技能的、得到充分培训的医务工作者。那对于这些比较脆弱的卫生系统的国家而言，之前我所讲到的公众的大规模的自我采取的预防措施就显得更为重要。
Some of the best examples are the places where the epidemic did not happen or has not happened. And when you see the actions, the public health actions that were taken in some of the provinces of China, where the numbers were kept very low and spread out over time, that is the ideal situation for the rest of the world, for those countries that can manage to mount such a strong public health measure.
在中国有一些非常好的例子，比如在一些本来尚没有疫情的这样的省份，或者疫情虽已发生但病例数极低的省份，却采取了非常强有力的公众的大规模的预防措施。我们也见到，在这些省份病例数持续保持较低，或后续出现了大量的下降，这是非常理想和完美的一个通过公众预防措施去提供准备的例子，可以为其他的国家所借鉴。
The world is meeting this virus for the first time, and every day there are new things being learned. One hopes that in the coming months we will have more and more understanding on how, with cooperation and with investment in the health systems, we can more and more mitigate the impact of this epidemic, of this pandemic.
整个世界是第一次与新冠病毒交手，每一天我们都有新学习到的东西。希望在未来的数月中，通过加强国际合作，通过加强在公共卫生系统中的投资，我们能够逐渐地掌握更多的应对的知识，以便进一步的减轻新冠肺炎对全球的影响。
Thank you.
谢谢。
Thank you. Now we allow further questions. The journalist on the right, the fourth row, the third journalist. Thank you, DJ Mi. I'm from Shenzhen TV, and many of the severe cases are in Wuhan. So what are the difficulties they are facing? For those severe patients, what kind of measures we will adopt to save their lives? Now the floor is given to Madam Guo Yanhong. Thank you for your question. By April 6, 24, the severe cases of Wuhan decreased from 9,000 at the peak to 181 cases only. So we have made great achievements. However, those severe cases also facing difficulties. The difficulties they are facing are several. First, there are many of those severe cases who are elderly people who suffer from underlying conditions and also who migrate fastly. So this poses great challenges for treatment and care. For severe cases, treatment will adopt several measures. The first measure we adopt is that we will further achieve full concentration. We will concentrate those severe cases to top hospitals. Through top teams and top doctors and nurses, we can strengthen our treatment of those severe cases. We will concentrate the patients and concentrated experts and concentrated resources to provide concentrated treatment. We also emphasize cooperation among different disciplines for underlying conditions. For severe patients with more than 2 underlying conditions, we have to focus on their underlying conditions as well and work on their underlying conditions and COVID-19 together. Multidisciplinary experts should work together to cure them. Next, we also strengthen nursing job. For severe cases, the nursing of them are very challenging. For elderly people, the nursing work is highly vital, and we have to closely monitor their pricing of the disease and adopt different measures to treat them and protect their respiratory tract, and also try to monitor their blood and strengthen nursing provided to them. Fourth, previously we have expert doctor dispatch to different hospitals. Now these experts will be sent to a hospital to work there only for these severe cases so as to increase the efforts and attention given to those severe cases. We also have difficult cases discussion mechanisms. Experts and doctors will discuss together how to solve these difficult cases. So we will try different measures to save more lives. That's all. Thank you. Thank you. We allow further questions. Journalist on the left, on the first row, there's a lady. Thank you, Chair. I'm from Shenzhen Special Economic Zone, and different hospitals are treating imported cases. What about the treatment of those important cases? Now, Madam Go Yanhong have the floor again. Imported cases are increasing in China. For important cases and their treatment, we also adopt the same principle. That is, for mild cases, we will have a concentrated treatment so as to avoid transmission, and also we will pay attention to their disease progress during the treatment process. For those mild cases, we will strengthen management and treatment of them, increase their cure rate, and also prevent the mild case to migrate to severe case. For severe cases that is imported, we will have a full concentration of resources and experts to strengthen our treatment to them, and also we have an expert discussion mechanism to find the best solution to them. We will follow the solution founded by the expert group, and we will also provide customized solutions to each patient. In line with the basic conditions of the patient, we will provide targeted solutions and different solutions. Fourthly, we emphasize the competition of traditional Chinese medicine and Western medicine. In fighting against virus, the combination of Western medicine and Chinese medicine are very important in increasing the cure rate. In China, for this imported confirmed case, we have 983 of them, and 285 have been cured, and among these 698 hospitalized confirmed cases, 21 of them are severe cases. So our experience are also usable to those important cases. Thank you. We allow further questions. Journalist on the right side, the third row, the lady. Thank you. In the treatment of the patient, psychological counseling and support are very important. What are the role played by the nurses? How can we strengthen our psychological care to patients? Now the floor is given to Madam Wu Xinjuan. Thank you. To face up to this emerging COVID-19, for patients, they are facing uncertainties and they are facing a new environment in a new hospital without the company of their relatives. So this will result in increased anxiety on the part of the patients. So for doctors and nurses, they are providing psychological support to those patients. This psychological support are a kind of a good medicine to patients for them to increase their confidence. We can do work on several fronts. First, we will strengthen our communication with the patients. If we have increased communication with the patients, we can establish trust between doctors, nurses, and patients. We also share successful examples to the patients, telling them the progress of their disease and sending confidence to the patients. Because the relatives cannot keep a company of those patients, through our nursing teams, we can, through mobile phone, help the patients to communicate with their relatives, communicate with their friends. In this way, their tension, their anxiety can be alleviated, and through such a method, we can convey to their relatives and convey from the relatives to the patients the confidence in the cure. So the patients became more hopeful of their future. In daily details, we also try to show our care to the patients, enabling them to feel our warmth of affection. In this COVID-19 fight, we also have many impressive stories between nurses and the patients, between doctors and the patients. For example, in Wuhan Tongji Hospital, in ICUs, when the nurse knows that the patient she is carrying is to have a birthday, they made a birthday cake for this patient and hand in on his birthday and sing a birthday song to him, enabling our patient to be impressed and to feel confident. Our nurses also, when they are off duty, when they come back to their hotel, the nurses will make some handmade crafts so as to encourage those patients to cooperate with the doctors, and they will fold some lucky birds in paper to convey their gratitude, to convey their best wishes to the patients. And also the nurses are bringing fruits to the hospital walls. And on the desk of each hospital bed, and there will be a red apple. This is a sign of good luck for patient. So this detailed counselors carry our spiritual and psychological support to the patients, enabling them to be more confident about this, their future, and help them to overcome their anxieties. Thank you.
Journalist from the second row on the right side, please. Thank you. China Youth Daily. The medical team supporting Wuhan and Hubei had a female nurse composition of 60%. Why are so many nurses needed for the treatment of COVID-19? What are their specific roles? I'd like to again ask Madam Wu Xinjuan to take the question. Yes, indeed. The nursing staff was almost 60% of the entire medical team
I'd like to take this opportunity to share with you the specific jobs carried out by nurses. In the treatment of severe and critical patients, nurses were the mainstay. They provided professional nursing services to the patients. I had this experience when I was working in the ICU unit of a China French hospital. We have the most severe patients or the critical patients. The progression of the disease was fast with multi-organ failure or multiple complications. The nursing workload was enormous. Therefore, there was a high demand on the professional skills needed for nurses. Nurses have to provide the services to ensure the daily life of the patients. Most patients could not walk, and most of the patients had invasive ventilation support, so there was a lot of needs, and also the oral protection, nutrition support were needed. The nurses had to closely monitor the vital signs of the patients and notice any major progression of the patients and adopt forward-looking interventions to prevent the development of complications. For severe and critical patients, for example, patients with the ventilators or invasive ventilators, highly professional skills are needed in respiratory tracts management, ECMO-assisted treatment, and superimposition ventilation. And all these need a lot of professional skills. An example to be shared, take the ICU unit I worked, for example, at most a dozen of patients have to use ECMO, which was an effective way to deal with acute respiratory syndrome. 5 to 6 nurses may be needed to change the body positions of the patients for the ECMO support. Also with the multiple tubes, assistive machines have to keep their stable function. And also we have to look after the skin contexture of the patients after ventilation in prone position was adopted. Besides, apart from these physical nursing, psychological support is also needed from nurses to not only relieve but also comfort. They talk with the patients, they comfort them, they provide psychological support to the patients. And for the mild patients, take the mobile camping or field hospital, for example. Nurses need to monitor temperature, collect samples, provide nutritional support, disinfection, quarantine, daily activity supports, and psychological counseling. So in general, in the COVID-19 response, nurses have played a vital role. Thank you. Next question, please. Journalist from the 5th row on the right, on the left side. With CNS, according to latest data, 77,000 patients have been discharged and released from hospitals. And what have been the nursing experiences we've accumulated during the past 3 months? Madam Guo Yanhong. Thank you for your question. Yes, indeed, we found the majority of the patients have been cured and discharged from hospitals. COVID-19 is an emerging infectious disease. However, in the response efforts, with our joint and concerted efforts, valuable experiences have been accumulated that can be summarized in the following aspects. First, the gradual continuous optimization and the updating of diagnosis and treatment protocols. On one hand, the proven effective diagnosis and treatment practices have been added to these protocols. At the same time, on the other hand, the science and research results have been integrated into the protocols as well. During this process, we paid special attention to the combination of Western medicine and traditional Chinese medicine. You may have noticed that there is embodiment of the TCM practices, which can cover mild case, moderate, and severe cases. Besides, for different stages and for different key points, for example, for severe and critical patients, we have optimized our protocols and worked out 3 editions of protocols on severe and critical patients. We also had work plans to support the patients in rehabilitation stage so that we do cover the entire course of the disease. So this is the experience number 1. Second, we have been implementing the 4 poolings and 4 earlies: early identification, reporting, quarantine, and treatment have been effective in reducing infection and improving cure rate. We have been expanding and providing more medical supplies to improve the testing capacity. So this has been the experience number 2 in implementing the 4 earlies. Wuhan has been quick in expanding the hospital bed capacity, improving testing capacity, and streamlining the work procedures. For severe patients, the pooling of resources, the pooling of patients have been adopted. The comprehensive and tertiary hospitals have been designated as the hospitals to treat the severe patients. We've improved the cure rate among the patients. I've also noticed that Dr. Gordon Gallia have some high praise for China's practices in organizing the medical team support to support Wuhan. Yes, indeed, that is also an aspect of our 4 poolings, the pooling together of medical resources. And that has been one of the most valuable lessons for us. And the third experience is to act earlier, in particular in the diagnosis and the treatment. We need to intervene much earlier to prevent mild cases from escalating into severe cases. Adopt a proactive or preemptive approach by providing oxygen support, intubation, or mechanical ventilation. So we were preemptive and proactive in acting earlier and have a forward-looking perspective. And experience number 4.
We adopt a scientific method for treatment and diagnosis. For precise treatment, we combine basic medicine with clinical medicine. And for the findings of basic medicine, these are used in clinical medicine in a timely manner. And also, for people working on the front line, they are working together with disciplinary experts at the back office. On the front line, we have different medical teams. While in providing the diagnosis through 5G, through telemedicine, our back office experts provide support and provide diagnosis and solutions to the frontline workers. And also the nurses and the doctors also work together closely within the medical teams to Wuhan. Nurses take up about 70% of the total team. It means that for the cure of a disease, 30% of the efforts come from doctors, 70% come from the nurses. So nurses are also playing an important role in this fight. In implementing scientific diagnosis and treatment, we pay attention to medical services and management. Through management enhancement, we can enhance the homogeneity of the treatment result. And also we try to combine Chinese medicine with Western medicine, play the role of Chinese medicine in the cure of COVID-19. All of these experiences are very useful for guiding our future works, and we will use this experience in our future work. And Mr. Gui Qiang is also an expert, and he has many experiences. So I want to give the floor to Gui Qiang. Thank you, DJ Guo, who gave us a detailed introduction about our experiences. These are precious experiences coming from our daily practice. COVID-19 is a new emerging infectious disease. Our understanding about this disease at the very beginning are very weak. And based on our past experience about SARS, MERS, and HIV and bird flu, and we found out that early diagnosis and early treatment are very important for the prevention of the disease. And also tiered and classified treatment are also very important. And we classify cases into extremely mild cases, and severe cases. Based on the different category of the cases, we adopt different treatments. For very mild cases, they will be subject to surveillance, while effective resources, medical resources, will be given to those severe cases. This is very important for classified treatment. And also, early oxygen treatment are very important because this virus attack your lung, and so we have non-invasive, invasive, without tract and tract-based intubation, so as to encourage effective oxygen treatment. And also, Madam Guo have mentioned that our treatment plan are constantly updated. Because this is a new disease, people's experience are limited. However, NHC organize experts on the front line and at the back office to make a judgment about the fatal case, to find early warning signals so as to offer guidance to the frontline workers. While the frontline doctors and nurses are also doing some scientific research while they treat the patients. Based on the accumulated experience, based on the data accumulated, we update our treatment plan on a regular basis. Within 1 month, we update this treatment plan by 7 times. So this updated treatment plan provides an effective guidance for COVID-19 cure. And for severe case and mildly severe case treatment plan, we also update that by 3 versions. So this is an important technical support for COVID-19 fight, and this is also an important model to be learned. Our treatment plan are communicated to many countries around the world. I myself participate a dozen of meetings with other countries to communicate our treatment plan to other countries, help them to fight against COVID-19. This is a precious experience. Just now, to be specific, our technical advances and our technical output are used in the treatment of patients. By that I mean, we have used some antiviral drugs because there is no effective drug for this virus at the very beginning. So we initiate clinical observation of many antiviral drugs, including chloroquine and now it is proved to be effective. And also, we have other drugs.
接受率增加，那我们就知道
And for any infectious disease, and they have inflammatory factors, and for tocilizumab, this is very important. And also for plasma from recovered patients are very important. Stem cell treatment are also very important. And through the accumulation of experiences, and we are updating our treatment plan constantly. And we also have